I'm Alan Daniels, Chief of Spine Surgery at University of Orthopedics and the Miriam Hospital. I'm an adult spine surgeon. In my practice, I treat the full gamut of spinal disorders, from relatively straightforward and simple spine problems to very complex deformities and revision spine surgeries. The ideal patient for me is someone who has a spine problem that's severe enough that they can't do the things they want to do. They've tried non-operative management and they're really fed up and they're looking for relief and they're willing to have surgery to do it. Most of my patients are from the region, but I also take care of patients from all around the country that are willing to travel to Rhode Island to undergo very complex spinal reconstructions. Spinal conditions can be so all-encompassing. They can really overwhelm patients' lives. The gnawing nerve pain and gnawing neck and back pain can take all the joy out of life and can really impact patients' abilities to work, to sleep, to exercise, to just do the things they love to do with their families. We see patients at sometimes their lowest points, their most desperate points. I truly sympathize with patients, and it's really an honor to be able to provide them an option for pain relief. After undergraduate school, I was looking at medical school, so I got a job working as an operating room technician. I got to work in the operating room, which was very cool, of course. And I got to see all different kinds of surgery. And I saw trauma surgeries and neurosurgeries and orthopedic surgeries and general surgery. And as soon as I went in the spine room, I just thought it was the coolest thing in the world. I thought the reconstructions that they were doing to realign the spine were just nearly miraculous. I thought the people in the room were so cool what they were doing. It literally was a calling for me. I just knew it was what I wanted to do. We're very lucky to be living in a time when spine surgery is highly successful. In the past, there was some reputation of spine surgeries that the results aren't always good or the complication rates are very high, but over time we've developed techniques which are very reliable to provide excellent outcomes to patients, where they often return to either painless or much improved pain with full function. And so we've been very fortunate to have a lot of technological advancements in spine where we can provide relatively rapid relief, low complication rates, and really good outcomes. One of the things that makes our spine center special is all of the spine research that we do. We track our patient outcomes to ensure that our outcomes are as good or better than other comparable centers around the country. If we were to do an anterior approach, it's a pretty straightforward thing. You basically just put a plate on this. Yeah. It helps us to advise patients on what they should expect postoperatively, and really it's helped to build our national prominence where people see what a great job we're doing here in Rhode Island. Most of our spine surgery is being done at the Miriam Hospital, where we recently achieved accreditation from the Joint Commission for Advanced Care in Spine Surgery. The Center of Excellence at the Miriam Hospital has been tracking our outcome data. We have excellent patient outcomes with extremely low complication rates. Spine surgery is a team sport. It is a really important component of care to have a good experience top to bottom. We have 8 adult spine surgeons in our group, and we've all subspecialized over time. I have absolute best administrative assistants, the best physician assistants, and just a wonderful team around me to help take care of patients. All of us have this really shared goal to try to give people the best relief they can. We should treat every patient like a family member or like a VIP because they really appreciate it. These spine problems are really impactful to their lives, and to have the opportunity to provide them relief from their symptoms and get back to their full active lives and to really provide life-changing operations is such an honor, and I take it very seriously. Being a spine surgeon is the greatest job in the world. To be able to provide patients, often with instant relief of their symptoms, is so gratifying. To have somebody who's bent over or has a very curved spine, to be able to help them stand up straight is one of the greatest feelings in the world. It just makes the job worth it every day.